Over half the adult population, specifically 60% of adults, have one or more diet-related chronic diseases in the US. Taking care of our body is taking care of our future, and a poor diet can have a substantial effect on your physical health by increasing your chances of developing a chronic disease later in life. On a global scale, many suffer from various chronic diseases, and one of the best preventative methods to this is having a healthy diet. Americans alone have extremely prevalent rates of chronic disease, some of the most common being obesity and type 2 diabetes. Given America is so advanced in modern medicine, it poses a big question as to why its people are so unhealthy. Whether it's lack of knowledge, care, or accessibility, making it clear that change needs to be had is necessary for a healthier future for all. Hi, I'm Erica Nordland, and I've been researching the relationship between poor nutrition and chronic disease in the US. Over the course of the past century, there's been a drastic change in the diets of Americans. Dorothea Lange was a famous photographer during the Depression era who documented and aimed to bring light to the tragedy of food insecurity and focused a lot of her work on the Farm Security Administration. This photo, commonly known as Migrant Mother, was taken by Lange and draws attention to the importance of her work and the tragedy and the hardships encountered with food struggles in America. Inspired by her efforts to bring awareness to this subject, I have focused my research on food and our relationship with it, but in accordance to modern-day struggles. In the US, currently 50% of Americans have at least one chronic condition. Of this, 60% are adults, and 42% of those adults suffer from more than one. When half of the population is affected by this issue, it leads us to question the causes and solutions to this crisis. Specifically, to what extent has poor nutrition in the US led to an increase in chronic disease in adults over 50? As established before, eating unhealthy raises your chances of developing a chronic disease in the future. Specifically, poor eating habits such as overconsumption and underconsumption of necessary nutrients. The Dietary Guidelines for Americans provides the recommended diet while making comparisons to the current averages, as you can see in this graph. This data chart helps provide a realistic comparison as to the status of where American diets currently are and where they need to be. As you can see in most categories, specifically vegetables, dairy, and fruit, the average consumption is evidently lower than the amount it should be for a sufficient diet. All three of these food groups are imperative to good health, and specifically vegetables and fruit are key to the prevention of chronic disease. They provide a plethora of benefits, such as reduced chances of high blood pressure, also known as hypertension, which is a huge risk factor for developing a chronic condition. They also promote good digestive function, reduce chances for heart disease, and certain cancers. The Dietary Guidelines for Americans also release data on adults aged 31 to 59, showing the average intake of varying qualities of food like sugar, fat, and sodium. One of the key nutrients to keeping a healthy metabolism and regulating bodily functions is sodium. However, as you can see, there are comparatively high rates of overconsumption, which may lead to many negative side effects such as hypertension. And if prolonged, this raises your chances for developing chronic conditions such as heart disease. Unfortunately, the CDC revealed that 9 in 10 Americans have too high levels of sodium intake. According to the National Center for Disease Control and Prevention in regards to sodium, current guidelines recommend getting less than 2,300 milligrams a day, but Americans consume more than 3,400 milligrams a day on average. Additionally, over 70% of the sodium that Americans eat comes from packaged, processed, store-bought, and restaurant foods. Over the past century, there's been an increase in the number of artificial and supplemental ingredients in American foods that has contributed to a lack of good nutrition in our diets. Consuming sugar-sweetened beverages and highly processed foods can lead to weight gain, obesity, and other chronic conditions that put people at a higher risk for at least 13 types of cancer. Bad eating habits that consist of products which include unnecessary high amounts of sugar and sodium can also be less satisfying to what your body needs, so we tend to eat more. However, eating higher quantities of these processed foods can lead to greater chances of obesity and eventually diabetes. In fact, in recent times, the number of adults with diagnosed diabetes has nearly doubled as the US population has increased, aged, and become more overweight. As you can see, other conditions developed from bad eating further raise your chances of developing chronic conditions in the future, which all the while supports how poor nutrition is leading to more cases in the US. In addition, the US Department of Agriculture reveals that the average American ate almost 20% more calories in the year 2000 than they did in 1983, due to an increase in meat production and fast food industries. Additionally, consumption of added fats shot up by around 2/3 over the same period. We can see in this graph the common food groups that people consume and comparisons over the amount of unnecessary calories included in processed foods versus what they should be. Making healthier choices, like selecting items that are more nutrient dense, can help people avoid these issues that they may not even be aware they have. Taking care of our bodies through a good diet can help slow down chronic conditions as long as we have the information to know where this issue stems from. However, several food companies supplement certain ingredients in their products to target a certain appearance, such as being considered a low-fat item. To provide more detail, many companies are simply swapping the hydrogenated oils and sugar in for the animal fats they removed. So this loophole allows companies to market their products as healthier when actually the supplements they utilize raise the bad cholesterol in our bodies, and increase our chances of developing heart disease, stroke, and diabetes. Chronic diseases such as heart disease and diabetes, as well as cancer, are the leading cause of death and disability in the United States. And so bringing more attention into what people are actually consuming and why they should care is imperative to the health of our country. Luckily, in hopes of counteracting the rising rates of chronic disease, some solutions are available. These include healthier eating habits, like making sure you have a balanced meal every time you eat, by avoiding heavily processed and sugary foods, being mindful and researching what you're putting into your body, as well as holding food companies accountable for what ingredients they're making their products with. However, there are also several limitations to this, such as cost, accessibility, and having the proper knowledge. Artificial and heavily processed foods tend to be more affordable than fresh produce, and some healthier options which may not be an option for most people to access. Having accessibility to local markets or stores that promote healthier eating are also more likely to harder to access than fast food establishments due to their frequency and proximity to highly populated areas. And lastly, not everyone has the ability to ask a primary care physician or nutritionist as to what they should be eating or even know to ask. Thank you. Oh, sorry.
Won't be on camera. Come in closer. What evidence did you gather that you did not use, and then why didn't you use it?
So I found a little bit of information on how much the U.S. healthcare system spends on preventative medicine, and although the information was relevant, I felt like it distracted from my overall topic of poor nutrition in general and its relationship to chronic disease, so I decided not to include it.
All right. And how did you use the conclusions of others to help advance your research?
The conclusions, like in my sources?
The conclusion of others when you did research.
Okay, so when I did research, I found a lot of people discussing how there was a lack of knowledge in the American society about how dangerous foods can be and what you're consuming and like the importance of it to your health. And so I was able to tie that into my solution of creating a more knowledgeable society.